I went in for my annual wellness test with my PCP, and she knew that I smoked, and we had tried some things. I tried the gum and the patches and the Chantix, and none of that worked. And she asked me, "How long have you been smoking?" And when I started to add it up, it was like 55 years. And she said, "I'm going to send you for a CT scan." And then that's when she recommended Dr. Woolley.
One of the biggest programs that we have here is our lung screening program. And that was specifically started nationwide to look at people who have smoked in the past, or some of them are still currently smoking, but have a significant risk from the smoking. And what they get is a reduced dose CT scan. So they're very quick, they don't have a lot of radiation, which is why we do them that way. But they allow us to be able to look at somebody and see if there's something suspicious.
Well, I asked Dr. Woolley, could he tell how long it had been there, how long I'd had it, and there wasn't, any way he could tell that. Just that it came up, on the PET scan, that it was, cancerous, and said because it was so small, we could probably go in and do it in one swoop, was what he did.
Her staging was a 1A2, which makes it a very small tumor. The only one better is 1A1. Those are less than 1 centimeter. Hers was a little bigger than a centimeter, so she's 1A2. One of the benefits of the program that we have here is our robotics program. There are a lot of advantages to the robot across all the disciplines for the patient, and those advantages are usually less blood loss and quicker recovery. The advantages for the surgeon, at least from my standpoint, is I see a lot better in these than I do in regular operations.
It was a pleasant experience, I didn't have any bad moments or anything like that. Everybody was just really helpful, concerned, asked me a lot of questions, constantly, how you doing, how you feeling, and I said after 2 days I was ready to go home.
Unfortunately, lung cancer is on the rise. It's now on the rise for women too, but we think that's probably from more women having smoked in the 70s and 80s than in the past. We're also starting to see some more of it in the people who are not smokers, and I think secondhand smoke does have something to do with it. We've always had that question, but I have a lot of patients who never smoked, but their spouse smoked or something along those lines, and they were exposed. And unfortunately, we're seeing it in some people who were never exposed to anything, and we're not sure where theirs is coming from. So it's a big problem. Things you can do to help avoid it. If you avoid your cigarettes, you're better off. If you get your home tested for radon and it's safe, you're better off. And stay away from any of those chemicals that are out there that you shouldn't be breathing.
If you can quit, do it. It's not worth risking your health. It's really not. To any former or present smokers, ask for a CT scan. I never thought of asking for it. Luckily my doctor had the presence enough, to know that I had smoked for so long, and, sent me for the CT scan. And it was basically her that, saved my life.